My eyes look worse after under-eye filler. What do I do?
Using cosmetic fillers to treat eye bags and under-eye hollowing has grown in popularity over the past several years. Many people are unaware that fillers can be placed by physicians and non-physicians with no surgical experience. The safety of the fillers and the willingness of the manufacturers to sell more product, along with local state laws, allow fillers to be used without any standardization or oversight. The problem is that fillers are not always the treatment of choice in many situations. Overlooking the factors which determine who is a better candidate for filler placement has led to many people having too much filler placed under their eyes. This resulted in the appearance of eye bags, lumps, and irregularities, or even larger eye bags than they had before treatment. Fortunately, hyaluronic acid fillers are reversible and results can be corrected and managed. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm well known for my work with upper and lower eyelid surgery, including surgeries for hooded upper eyelids, lower eye bags, double eyelid surgery, and oculoplastic specialty procedures such as ptosis and a lacrimal gland and system surgeries. As an eyelid specialist, I also perform revision work for eyelid surgeries originally performed by other doctors, and these patients come to us from all over the world. I'm also known for my work with facial fillers in areas such as the cheeks, jawline, lips, chin, forehead, as well as both the upper and lower eyelids. I also help patients with reapplication of fillers they've had done elsewhere. This is done by dissolving their original filler and starting from scratch, and in some patients who have had semi-permanent fillers, actually surgically removing them before applying a filler with lower risk. Cosmetic fillers are effective for slight cases of under-eye bags, as well as under-eye hollowing. Filler is placed in the tear trough below the eye bags to blend with the forward projection of the puffy under-eye bag, making the bags look less puffy. This works well with eye bags that are not too prominent, as the filler can create a more consistent contour under the eyes and camouflage the presence of the bags. However, if the eye bags are too prominent and the filler is added to blend it, too much volume from the filler can exceed a natural-looking contour of the under-eye area. So the under-eye area looks more puffy than before the filler was placed. An experienced eyelid surgeon who also performs under-eye fillers knows where to draw the line between using filler to camouflage slight eye bags and when surgery is needed to reduce and sculpt the fat that causes the more prominent eye bags. Unfortunately, if a doctor, nurse, or other practitioner cannot perform surgery in cases of larger eye bags, they may insist on using filler to treat this area themselves rather than referring their patient to a surgeon. When someone is dissatisfied with hyaluronic acid fillers done elsewhere, I often use hyaluronidase, an enzyme, to dissolve the filler and determine what is the true underlying anatomy. Once I see the true anatomy, I make recommendations regarding placement of filler, surgical correction, or a combination of the two. There are times when someone had filler placed under the eyes several years prior and expected the filler to disappear. Oftentimes, these patients look swollen and feel that they don't quite look like themselves. Generally, fillers placed in this area are metabolized over the course of 4 to 12 months. If filler is still present after 12 months, this may be due to something called encapsulation. Encapsulation is when the body forms a barrier around the filler which prevents it from being metabolized naturally. In situations like this, the enzyme hyaluronidase can be placed at the right tissue levels to dissolve the filler. Results from hyaluronidase can often be seen immediately. However, some fluid and swelling may take some time to diminish. Many times I've seen patients whose doctors attempted to dissolve their filler several times without success. This is where surgical experience with deeper anatomy allows me to place hyaluronidase more precisely to reveal the patient's true anatomy. I usually tell my patients to come back after a week or two to assess if any residual filler may be present and if additional dissolution is needed. My patients routinely go back to work the same day or the next day. So what if dissolving of the under-eye filler reveals prominent under-eye bags and surgery is the appropriate solution? I've developed a strategy to perform surgery in a way which provides my patients with a natural appearance with quicker recovery and minimal downtime. It comes down to surgical technique, medical staff coordination, type of anesthesia, and aftercare. In my practice, I routinely perform under-eye bag surgery in my office operating facilities, certified by the Joint Commission, with local anesthesia and light intravenous or IV sedation. I perform a procedure called transconjunctival blepharoplasty, which allows me to address the fat pockets from the inside of the eyelids, which, though technically more complex, is actually less traumatic and disruptive to the eye anatomy. This preserves the true shape that most people want to maintain. Essentially, my patients are able to go back to work in 1 week with minimal swelling or bruising. In fact, many patients who've come to us to address their dissatisfaction with fillers have recounted how they had swelling and bruising for weeks after filler placement. They are often impressed on how my performing surgery resulted in less swelling and bruising than when they had filler injection. Many times my patients who come in for removal of filler are doing so because they have an important event coming up. Whether I place filler or perform surgery, I would recommend at least 2 weeks of lead time to allow for settling and stability. The growing popularity of non-invasive procedures creates a perception that these solutions are just as good as surgery. This is, of course, not true, but these procedures do have a place. As a surgeon, I've integrated many minimally invasive procedures in my practice, including injectables, microneedling, lasers, and radiofrequency technology to provide my patients with comprehensive strategies and solutions, particularly in areas where surgery is not enough for a patient's full needs. It's important to recognize that any procedure where the skin is being medically altered or a needle is being placed through the skin is an invasive procedure. I routinely place fillers for patients who have minimal fat prolapse with under-eye hollowing. I also will not perform injectables when surgery is the more appropriate solution. Your option, if under-eye filler makes your eyes look worse, is to first dissolve the filler to restore your pre-filler anatomy. Once that is done, you can determine what is appropriate in your situation, now knowing that both injectable placement and surgery can have comparable risk and recovery. I hope you found this information helpful. Thank you for your question.